I'm Natalie Pasquarella. Thank you for joining us. Chuck has the night off tonight. A crucial battle is here in the coronavirus fight. Governor Cuomo warns that New York is just days away from what he calls D-Day. New York has now seen the largest single-day spike in coronavirus deaths since this pandemic began. 2,935 people have now lost their lives, more than the number of people who died on 9/11. A 400% jump in 7 days. Nearly 103,000 people have been infected, a jump of almost 130% in a week. And tonight there is an urgent need for healthcare workers. For the first time, the city used its emergency alert system to recruit more workers. You might have seen this on your phone here just in the past hour. And this is why Mayor de Blasio says he needs an extra 45,000 clinical workers to keep things going through next month. And 2,500 to 3,000 ventilators are needed right now to keep things going through just next week. The mayor and governor both say that unused ventilators will be seized from private companies to help increase that number. All right, let's give you a closer look here at the tri-state. 646 people have died in New Jersey, more than 29,000 cases there. In Connecticut, we know that 131 people have died with almost 5,000 cases. But the good news, almost 9,000 people have recovered and left hospitals in New York as cases for the first time have surpassed 100,000. A lot to get to tonight. We want to start with News 4's Andrew Siff live at the Javits Center. Andrew, good evening.
Well, Natalie, good evening. I'm wearing a facial covering, which is consistent not only with the New York City mayor's recommendation for all New Yorkers, but late today, the CDC recommending voluntary face coverings for all Americans. This, as a critical juncture comes up for New York, the mayor has been pointing to Sunday, April 5th, in terms of needing personnel and equipment to save patients' lives. Hospitals in New York City just days away from a crisis if up to 3,000 ventilators don't arrive by next week.
If we're going to save every single life we can save, we must have the ventilators we need exactly where we need them, when we need them.
Governor Cuomo earlier in the day with an executive order to bring ventilators from upstate hospitals to the city.
But I'm not going to be in a position where people are dying and we have several hundred ventilators in our own state somewhere else.
The governor also announced beds at the Javits Center will be used for COVID patients, reversing the original plan. And today, the New England Patriots delivered hundreds of thousands of protective masks. Meanwhile, the USNS Comfort, criticized by hospital administrators for not taking coronavirus patients, changing protocol. A patient will no longer require a negative COVID-19 test in order to be admitted. Each individual now screened by temperature and a short questionnaire. The goal, easing the pressure on hospitals.
Probably the busiest I've ever had to work or ever seen the hospital.
New Yorkers looking for signs of hope know that first responders like these members of the NYPD were out at Jamaica Hospital today delivering meals to medical staff. And then there are patients who've gotten better.
Personally, I tested positive. I came through it.
Rick Cotton only had mild symptoms, but finished a 14-day home quarantine. He runs the Port Authority, in charge of all the airports and also tunnels and bridges, like the GW, where truck traffic is only down 20%, a sign the supply chain is holding. Meanwhile, airport construction like LaGuardia, considered essential, continues.
We've made changes. There's almost no overtime, so that people, again, they can stagger shifts, strict maintenance of social distancing, the way you and I are.
And once again, here at the Javits Center, the big convention center on the west side, they've built up the capacity to 2,500 beds. They will be receiving coronavirus patients in an effort to ease the pressure on city hospitals. We're live on the west side. Andrew Siff, News 4 New York.
All right, Andrew, thank you. Now to New Jersey, where Governor Phil Murphy has ordered flags to half-staff statewide, and they will be that way until this pandemic is over. This comes as the Garden State, for the first time, reports more than 4,000 people have tested positive for the virus in just 24 hours. News 4's Brian Thompson is in Newark tonight with the new efforts to save lives.
The daily death count dropped, but the number of daily new cases soared by almost a third. And of course, that's putting even more pressure on overworked hospitals and their healthcare workers. And in what may be a first for New Jersey, the cafeteria at Hackensack University Medical Center has been turned into a low-grade COVID ward, 74 beds, with all the trimmings, so to speak, that you'd expect in a regular hospital room.
Think of it maybe as a field hospital on steroids.
The challenge for Hackensack: ambulances continue to pour into this hospital, some with coronavirus cases, others with something else. And those signs thanking healthcare workers real.
People are still having heart attacks, they're still having strokes, they still need emergency procedures.
This COVID ward from a cafeteria going up in just a week of round-the-clock effort. One face to the losses across New Jersey. Former CNN and CBS journalist, 35-year-old Shoshana Davis. Husband Adam Quartowitz telling NBC News of their last moment together.
It squeezed my hand, which after some oxygen she was able to, when I said to her, I just said, I want you to know I love you. And she squeezed my hand almost in a pattern that felt like she was saying, I love you back.
New Jersey flags will fly at half-staff indefinitely. Governor Murphy not dialing back his criticism of people adhering, whether at a home up north or a wedding in Lakewood.
A knucklehead is a knucklehead. I don't discriminate based on age.
And now face coverings. Newark's mayor asking everyone to wear them in public. Joined today by mayors of Morristown and Hoboken and probably others soon. Governor Murphy understanding but cautious about people backsliding.
You want to go ahead and do it? No issue. But don't assume that that makes you Superman or Superwoman and that you can ignore the social distancing that we are pounding the table on.
Despite nearly 1,000 new cases overnight, keeping this state as number 2 hardest hit in the nation, Hackensack University's president tells me that he expects the real surge to come next week. In Newark, Brian Thompson, News 4 New York.
Connecticut added nearly 2,000 new cases today and sadly 19 more deaths. Governor Ned Lamont just gave an update about an hour ago. The state now has a total of nearly 5,000 cases and 131 deaths. Now, the increases come just days after the governor warned that April would be a, quote, horrible month for coronavirus cases in Connecticut.
So I'm really confident that working together, working with all of our hospitals, working across the state of Connecticut, we're in as good a position as we can be given these circumstances.
Health officials there in Connecticut believe that Fairfield County will see a peak in the next few weeks, followed by New Haven and Hartford counties. Governor Cuomo says that Long Island has become a growing area of concern. The island has the second highest amount of cases in the state. That's when you combine both Suffolk and Nassau counties, surpassing 22,000. But what's even more troubling, Governor Cuomo says that 6 hospitals on the island are among those with the highest amount of COVID patients. News 4's Greg Sergel with one doctor's plea for help for her colleagues and her family.
The mask is on, and we're ready to tackle the day.
Dr. Evelina Graver used her phone to document a day for us. One of many days, she says, that are filled with the smells of fear and death.
It is heart-wrenching for us.
Dr. Graver oversees a COVID-19 unit here at North Shore University Hospital. Her 18 patients are all seriously ill on ventilators.
Walking into the hospital, very different feel at this period of time. I try to stay as numb as possible for the shift that I have to be here, whether or not it's 12, 14, 16 hours. But then when I get in my car, that's when it really hits.
What hits, she says, is an unfamiliar feeling of helplessness.
My team is already ready.
There is little her team can do for the patients. All are suffering here alone. Half, she says, under 60 and were healthy just days ago.
So people outside can't even imagine what actually takes place within these walls.
And when Dr. Graver leaves the hospital, she carries a different fear for the health of her 12-year-old daughter.
That's the first thing that I think about, and the last thing that I think about before going to sleep is to what in the world did I bring home.
Colleagues are getting sick, she says, and PPE is running short. At times, the battle seems overwhelming.
I cry. I think that's okay to actually say the fact that I do allow myself to, at a certain point, feel what this actually means.
Cheers like these caught Dr. Graver's ear while at home earlier this week. But she didn't know until her daughter explained that the applause was for medical professionals just like her.
I stopped in my tracks and I started to cry. It is incredibly heartwarming.
Dr. Graver wasn't able to take video inside her unit, but she tells me if we could see what she's been seeing every day, no one would ever leave their homes.
Now I'm about to walk into the unit. Be safe, everyone.
Greg Sergel, News 4 New York.